Have you ever felt sudden pain and swelling in your big toe, ankle, or knee? Or maybe you've had blood tests showing high uric acid levels? You're not alone. Today, high uric acid and gout are becoming extremely common worldwide, and food plays a much bigger role than most people realize. In this video, we'll understand what uric acid is, why it matters, the symptoms and risks of high uric acid, and the top 5 foods you should avoid if your uric acid levels are high. By the end, you'll know exactly how to protect your joints, kidneys, and overall health. Don't forget to like this video and subscribe to the Medical Diary of Dr. Chatterjee so you never miss simple and science-based health explanations. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCPUK, medicine specialist, diabetes and hormone specialist. Information is collected from trusted medical websites including Mayo Clinic, Cleveland Clinic, and patient.info. So first, what exactly is uric acid? Think of uric acid as a natural waste product. Your body produces it when it breaks down substances called purines, which are found in many foods and also made naturally inside your body. Normally, your kidneys filter out uric acid and remove it through urine, but problems occur when either the body produces too much uric acid or the kidneys can't remove it effectively. When uric acid builds up in the blood, it is called hyperuricemia. And when the levels go too high, uric acid forms tiny, needle-like crystals that deposit in the joints or kidneys. That's when painful problems like gout or kidney stones begin. For men, the healthy uric acid range is 3.5 to 7.2 milligrams per deciliter, and for women, 2.6 to 6 milligrams per deciliter. Anything above this is a warning sign. Now, what symptoms should you look out for? Sudden severe pain in a joint. Often the big toe is the first to be affected. Swelling, redness, and warmth around the joint. Stiffness, especially in the morning. In chronic cases, kidney stones, or reduced kidney function. Sometimes there are no visible symptoms, but blood tests show high uric acid. That's why awareness is so important. So now let's talk about the top 5 foods you should avoid if your uric acid is high. 1. Sugary drinks and high fructose foods. This is the #1 hidden trigger. Most people think uric acid only rises from red meat or seafood, but sugar, especially fructose, is a major culprit. When fructose is broken down in the liver, it produces purines, which immediately turn into uric acid. Research shows that even one sugary drink can raise uric acid within minutes. That means avoid sodas, colas, sweetened iced teas, energy drinks, and flavored waters. Even natural fruit juices like apple, grape, and orange juice can cause spikes. Dried fruits like raisins, dates, and figs are concentrated in sugar and act the same way. A Harvard study found that people who drank sugary drinks daily had a 74% higher risk of gout compared to those who rarely consumed them. Takeaway: stick to whole fruits in moderation. Fiber slows sugar absorption and reduces uric acid spikes. Prefer low fructose fruits such as berries, papaya, watermelon, oranges, and apples with skin. But avoid fruit juices and limit very sweet fruits like mangoes and grapes. 2. High purine legumes. Beans and lentils are considered healthy, but they also contain purines. Foods like kidney beans, black beans, chickpeas, and lentils have moderate to high purine content. For example, 100 grams of kidney beans has about 128 milligrams of purines. For a healthy person, this is not a problem, but if your uric acid is already high, these foods can push it higher. Takeaway: don't eat the same beans every day. Rotate with lower purine protein sources such as quinoa, tofu, eggs, or sprouts. One small serving of beans 2 to 3 times a week is fine, but avoid daily heavy portions. 3. Certain vegetables, spinach, cauliflower, mushrooms. Yes, vegetables are healthy, but some have moderate purine content. Spinach has about 57 milligrams of purines per 100 grams. Cauliflower has 51 milligrams. Mushrooms have 58 milligrams. For most people, this is harmless, but in gout or hyperuricemia, daily large servings of these can add to your uric acid load. Takeaway: eat them only occasionally, not daily. Replace them with low purine vegetables such as zucchini, cucumber, lettuce, bell peppers, carrots, or pumpkin. If you do eat spinach, boil it and throw away the water. That reduces its purine content. 4. Refined carbs and processed foods.
White bread, cakes, pastries, cookies, crackers, chips, fried fast food. These don't directly contain purines, but they indirectly make uric acid worse. How? They cause insulin resistance, which reduces the kidney's ability to flush uric acid out of the blood. As a result, uric acid levels rise and stay high. Takeaway: cut down on packaged snacks and bakery foods. Replace them with whole grains, roasted nuts, or plain popcorn for healthier snacking. 5. Alcohol, especially beer. Alcohol is one of the strongest risk factors for high uric acid and gout. It increases uric acid in 3 ways. Beer is rich in purines itself. Alcohol dehydrates the body, reducing uric acid clearance. The kidneys prioritize clearing alcohol instead of uric acid. Beer is the worst offender. Studies show beer drinkers have 1.5 times higher risk of gout compared to non-drinkers. Spirits and wine are less purine-rich, but still raise uric acid due to dehydration. Takeaway: if you have high uric acid, it's safest to avoid beer completely. Even with other alcohol, limit intake and drink plenty of water to reduce dehydration. So let's recap the 5 foods to avoid. Sugary drinks and fruit juices. High purine legumes like kidney beans and chickpeas. Vegetables like spinach, cauliflower, mushrooms, only occasionally. Refined carbs and processed snacks. Alcohol, especially beer. Now remember, just avoiding foods is not enough. Lifestyle plays a big role too. Obesity, crash dieting, lack of sleep, stress, and certain medicines can also raise uric acid. That's why a complete approach, healthy diet, exercise, and hydration works best. So the key message is, by avoiding these 5 high-risk food groups and choosing healthier alternatives, you can naturally lower your uric acid, protect your kidneys, and prevent painful gout attacks.
This script is written and reviewed by Dr. Shreyashi Chatterjee, MRC PUK, medicine specialist, diabetes, and hormone specialist. Sources include Mayo Clinic, Cleveland Clinic, and patient.info. If this video helped you, don't forget to like it and subscribe to the Medical Diary of Dr. Chatterjee, so more people can learn about their health in simple, easy language.